What if I told you that the blood pressure reading your doctor sees might not be the blood pressure that's actually affecting your health every day? Not because your doctor is doing anything wrong, not because the equipment isn't working, but because of something nobody ever really explains to patients. And it is affecting treatment decisions right now. Stay with me because by the end of this video, you're going to know exactly what to say to your doctor to fix it. Hey, I'm Florence, nurse practitioner, former ICU nurse, and I created this channel for one reason. It's to help you become the most effective communicator in that exam room so you leave every appointment with better care. So today's topic is one I really feel strongly about. It's one of the most common gaps that I see in practice, and almost nobody talks about it. Let's get into it. So here's a scenario I want you to think about. Okay, you have a doctor's appointment, you've been a little anxious, maybe life has been getting a lot lately to you. You sit in the waiting room, get called back, the cuff goes on, and you hold your breath. Sound familiar? So the reading comes back, your doctor nods, says your blood pressure is well controlled, and then you exhale, and then you feel relieved. But here is my question, and I want you to really sit with this. Was that reading actually representative of your blood pressure at 6 a.m. when your alarm goes off and you're already stressed, or at 11 p.m. when you can't sleep, on a Tuesday when work is overwhelming you? That one number taken in one moment is what your entire treatment plan is going to be based on. And for many patients, there is a real and significant gap between what happens in that room and then what happens the other 23 hours and 53 minutes of the day. Now, here's something worth knowing, and I want to share this purely as general education, not as a diagnosis for anyone watching, okay? Just a quick disclaimer. There are actually two recognized phenomena that clinicians are aware of when it comes to this gap between readings in the clinic and then readings at home. So the first is called white coat hypertension. This is when blood pressure reads higher than usual at the clinic because the clinical environment itself triggers a stress response in the body. The white coats, the cuff, the anticipation, your nervous system actually reacts to that. And that reaction can temporarily push your numbers to go up. The second, and the one that is less talked about, is called masked hypertension. This is the complete opposite. It's where your blood pressure appears normal or controlled at the clinic, but at home, under the pressure of real life, the readings tell a completely different story. I'm not sharing these to alarm you or to encourage anyone to self-diagnose. I'm sharing them because understanding that this gap exists and that it has a name should tell you something important. So, your doctor knows these phenomena exist, okay? What they may not know is whether it's happening to you, because that information can only come from you. Here is what I want you to understand about how blood pressure treatment decision gets made. Okay, so your doctor sees your blood pressure a few times a year. Let's get real about that. And it's in a very controlled clinical environment, and it's for about 60 seconds each visit, right? So based on those readings, combined with your symptoms and your history, they decide whether your medication is working, whether your dose needs adjusting, whether your treatment plan should change. Those are important decisions. They're life-affecting decisions, and they are being made without the data that only you have access to. So what happens in your body at home, in the morning, at night, under stress, after a hard week, you know how that is? That is valuable health information, and the only way it reaches your doctor is if you bring it to them. That is not your doctor's failure. That is a communication gap. And closing that gap is exactly what this channel is here to help you do. I want to take a moment to talk about something that doesn't get discussed enough. For a lot of us, and I'm speaking especially to my Filipino community, to those immigrant families, to anyone raised to respect authority and not ask too many questions, there is a deep discomfort with speaking up in a medical setting. We were raised to go to the doctor, listen carefully, say thank you, and then leave. To not seem difficult, to trust that if something was wrong, then the doctor would find it. I grew up around that. I understand it completely. But here is what I know from the clinical side. Your doctor really genuinely wants more information, not less. A patient who brings home readings, who asks questions, who shares context about their week, that patient is going to get better care every single time. Sharing your home readings is not being difficult. It is giving your doctor the tools to be able to do their job well. And you deserve care that's based on your full reality, not a 60-second snapshot. So, this is exactly what I want you to do. 3 steps, simple, doable. Step 1, get a home blood pressure monitor. Upper arm cuff, not wrist. Upper arm readings are more consistent for most people. Look for one that's validated. So the American Heart Association has a list of validated devices on their website. You don't need to spend a lot. A reliable monitor runs between $30 and $60. Step 2, measure correctly because technique matters. So sit quietly for 5 minutes first, feet flat, back supported, arm at heart level, take your reading in the morning before medications, and then before coffee, of course, and then again in the evening, and then write down both readings. So do this every day for about 2 weeks before your appointment. What you'll have is something your doctor has never had access to, which is a real picture of your blood pressure across different times, different days, different circumstances. So step 3, bring your log and use these words, okay? Write your readings down simply, date, morning reading, evening reading, and when your doctor comes in, just simply say this. That sentence tells your doctor you're engaged. It opens a conversation and then it invites them to do what they're trained to do, interpret the information, and guide your care. So you're not diagnosing yourself. You're not telling them they're wrong. You're just giving them more to work with. So when you bring this information to your doctor, they'll know what to do with it. That's their expertise, not yours. They might ask you to keep monitoring at home. They might want to discuss your readings further. They might have follow-up questions about your daily routine or lifestyle. So, whatever they recommend, that conversation is now happening and it wasn't before. That's the whole point of it. I want to leave you with something before we wrap up. Your doctor has 7 minutes with you approximately. You have the other 23 hours and 53 minutes of data they will never see unless you bring it to them. That data is not just numbers. It's the morning you woke up with a headache, the week everything fell apart, the nights you couldn't sleep. All of that is part of your health story, and your doctor deserves to know it. Not because the system has earned your openness, but because your health is worth fighting for. Give your doctor everything they need to actually help you. My free doctor visit conversation card includes a simple blood pressure log you can fill in at home and bring directly to your appointment along with exact words to start this conversation. One page, printable, link is in the description, and if this has helped you understand something your doctor never took the time to explain, share it. Please, someone in your life needs to hear this too. I'll see you in the next one.
I need you to lift me up. Lord, I cannot do this on my own. Take the wheel. Can you please just